Good evening and welcome to another edition of the COVID-19 pandemic update on Channels Television in collaboration with the Ford Foundation. I'm Millicent Walker. Here are some of the highlights this hour. Today, Channels Television correspondent fully kitted visits the Muhammadu Buhari Isolation Center in Kano, and this is an exclusive. Nigeria witnesses more coronavirus cases. Our guest this evening, the head of the NCDC Risk Management, she clarifies on the nationwide pandemic. And almost 7,000 students and teaching staff in Israel in quarantine and more than 40 schools closed, sparking fears of a second wave of COVID-19. Now, as the number of COVID-19 cases as well as deaths arising from the pandemic continue to rise, the race towards finding a solution is equally heating up across the globe. Given scarce resources, each country has to deal with its own challenge. Different regions are forced to look inwards for possible viable solutions, if not a vaccine, at least a treatment regimen. This has brought to the fore the need for Africa and, of course, Nigeria to search earnestly for homegrown solutions. So the question now is, can Africa find a cure? Since the continent reported its first few cases compared to other continents, it's been less figures, but the forecast for Africa on the impact of COVID-19 has been bleak in terms of predictions from projected fatalities. The World Health Organization, for one, has said close to 200,000 might see some deaths. But currently, there are COVID-19 infections figures on the continent, and we're looking at over 152,000 and 64,047 of whom have recovered. But sadly, 4,344 deaths have been recorded. As the days go by, many wonder if those predictions will come true, but only time will tell. In Africa, researchers, scientists, and even traditional herbal practitioners on the continent are searching earnestly for solutions. So far, the loudest is from Madagascar with a product known as the COVID Organics, traditional herbal practitioners. Also, we have one coming in, that is from Cameroon, a herbal essential oil. It's already been distributed there. This is by the Roman Catholic Archbishop Samuel Kalada. Is claiming to have found a cure for COVID-19. We also have some movement in Nigeria as the federal government identified 3 local herbal medicine practitioners and researchers appreciable prospects for a solution. But let's take a closer look at some of the purported remedy. You'll find at the Malagasy Institute of Applied Research, the remedy said to be a key component called Artemisia annua, also known as sweet wormwood. Now the core element of the tonic, Artemisia, the herbal plant, popularly known as Tarzagate, even in northern Nigeria. This is a remedy that comes in a bottle as a herbal drink, and it's also being packaged as dry leaves. And we're seeing a number of countries take receipt of this, so as well as has Nigeria, taking a look at some of the clinical components before administering for use, which is what we're being told. But this is definitely a solution, homegrown solutions we're seeing on the continent in Africa as the race is on to find a vaccine or a proper treatment regimen to solving COVID-19 across the world. And now, for those who are still in doubt as to the existence of COVID-19, the picture you're about to see may clear that doubt. This is because our correspondent Idris Jibrin in Kano State, donning his full protective suit there, visited the Muhammadu Buhari Isolation Center in Kano, where some of the COVID-19 patients are currently being treated. Now, Kano currently is number 2 in Nigeria after Lagos with the highest number of cases, but it has discharged 286 patients, recording 45 deaths.
In this case of COVID-19 in Kano was identified, and the subsequent response by the state's government some people in the state still don't believe the reality of the virus. Now, Channels Television has been allowed access to Muhammadu Buhari Isolation Center in Giginyu, and who you can see here are positive patients of COVID-19 who are receiving treatment in this isolation center. As at today, Kano State has tested over 4,000 samples. 970 are confirmed positive. 639 are active. 45 deaths recorded, while 286 patients have been discharged from various isolation centers across the state, including this one. Although the recent mysterious death recorded in the state is still unclear on whether it's COVID-19 related, but authorities confirm that investigation is still ongoing to know the real cause behind the mass death. Therefore, if you are still contemplating about the reality of COVID-19, these patients must have helped clear your doubts. From Muhammadu Buhari Isolation Center in Kano, Idris Jubrin, Channels Television News.
And from the Nigeria Center for Disease Control, NCDC, the total confirmed COVID-19 cases in Nigeria stands at 10,819, with the announcement of 241 new infections last night. Of the total confirmed cases, the number of active cases in Nigeria stands at 7,266, while 3,239 patients have recovered from the virus. And in the last 24 hours, we lost 15 people to COVID-19, putting the death toll today at 314. By region, Lagos in the southwest still has the highest number, over 5,000 cases. It has also discharged close to 1,000 cases. And next is Kano in the northwest with 970 cases. The FCT is the third highest in the north central region with 687 cases, while Borno in the northeast has the highest figure, 296. Edo in the south-south is number 5 in Nigeria after Katsina with 336 cases. Ebonyi leads in the southeast with 40 cases. Well, let's find out more on the national response to reducing the spread of the coronavirus. And joining us from Abuja is the NCDC Head of Risk Communication Division, Dr. Yaya Diso. He joins us on the program from Abuja. Thank you for joining us, Dr. Diso. Your center keeps updating the nation on the spread of COVID-19, and since we recorded our first case, but how much sensitization is going on into the rise in community transmission? And that is something your agency calls the silent spreaders that we're seeing today.
Thank you very much. It is quite clear that once we have community transmission, we need a community approach to be able to tackle community transmission. And then because of that, sensitization across all LGAs has been ongoing, and state is taking leadership of this, while the ownership is by the local government. And then, but the national provides the guideline, the capacity, the technical support for the states to be able to ensure that they do the mobilization effectively. More importantly is the messaging. And then at the national level, data are pulled together from all sources, from the social media, from the people who are on the field, from the states, and from media scanning, and to understand the way people understand this disease, and then their perception about this, and their concerns, so to be able to develop messaging that will be tailored to address the needs. And when these messaging are deployed, and the states also adapt them to capture the realities of those communities where we are having this. In particular, all spots in the country where active cases are reported have been mapped out to intensify transmission, to intensify sensitization, and to encourage people to comply with the guideline that has been released by the Presidential Task Force. So those are things that are ongoing now. And then you can see that the easing of the lockdown, with the easing of the lockdown, we continue to have increase in the number of cases, and this is expected because as people move, the virus move. But we cannot continue to be under lockdown forever. we need to balance livelihood with life. And then it's important for us to ensure that people take responsibility for adjusting to this new life that is required for us to be able to maintain ourselves in a safe way while we conduct our businesses.
Dr.
So
Desu.
I think what the federal government has done is to ensure that right information gets to the right people at the right time. We're also engaging the influencers in the community, traditional leaders and religious leaders, to ensure that this messaging gets to where they need to get to.
Dr. Desu, only today a medical doctor said to me that protective measures are thrown out the window. Not a lot of people are wearing their face masks and the rest. Perhaps you might want to speak on the preventive measures, but I want to first ask you, we understand that about 812 health workers have contracted COVID-19, and 28 of them are from the Center for Disease Control, the NCDC. We're wishing them, quick recovery, as of course they go through this. But a lot of people want to know what went wrong.
You will agree with me that this is a battle. It is a war against coronavirus. And then the healthcare workers are in the front line. And then there is no way you will fight the battle and then you may not have some casualties. But the important thing is for healthcare workers to adhere strictly to the infection prevention and control measures, which is meant to protect them, protect the patients, and to protect the community. But because a lot is being learned about this virus, and then the way it is transmitted, and then we know that it's transmitted by droplets, and then particularly when you have community transmission, you may not even know where these healthcare workers are picking this. Could it be in the health facility? Or could it be in the community? Could it be during when they are being transported from one place to the another, maybe to the place of work? But that is why we need all of society approach to ensure that we complement whatever that is being done in the hospital. In the hospital, we have infection prevention and control program. NCDC and the Federal Ministry of Health have trained over 10,000 healthcare workers in the country, both in our treatment centers and public and private health facilities where service the delivery takes place. So this is being complemented by intensified risk communication in the community to ensure that everybody plays their role. That is the only way we can keep ourselves safe.
Just before we let you go, Dr. Desu, what is the turnaround time for testing in Nigeria?
The issue of turnaround times varies from state to state because there are different challenges that each state encounter. When it starts from the collection of sample and transportation of sample to the lab, and then the test is conducted, and then the result is communicated back. But one of the challenges may be because we are having increase in the number of samples being collected, and then, of course, the number of healthcare workers that are doing this testing are not increasing as we are having increase in the number of cases.
So, Dr. Desu, would you say, Dr. Desu, I must come in here because I want to get specifics. I mean, the UK, for example, is working towards 24 hours. Now it's 2 days, 48 hours. But for Nigeria, are we looking, is it 2 days to 5 days based on all that you're getting from the States?
But ideally, we are saying 24 hours plus or minus, but then maybe 12 hours. But like I said, the challenges vary from state to state. You still have some states that don't have this treatment center. Samples have to be collected and be transported to states where they have, where they have the laboratories. So, and then sometimes it could be issue of communication, and then there are also challenges with the filling of the forms when the samples are being collected. People sometimes don't give their full identity, and that causes confusion. And for you to run the test in the lab, they need all the variables, and then even when they finish, and then in sorting out where this test result will go to, sometimes test samples are collected from one state, and then the person that has the sample is living in another state. It's just visiting that state. But the address is given is the state where it's coming from. So these are the kind of issues that they need to also sort out. But we're identifying these as challenges, and then responding to them to improve by the day.
We definitely know you join us again, but we'd like to thank you, Dr. Yahya Disso, the NCDC Head of Risk Communication Division. Thank you for joining us on the program.
You're welcome.
Still to come on our COVID-19 updates. On the second half of the program, we focus on protecting the rights of Nigerians in a pandemic. Do join us again. Welcome back. The Socioeconomic Rights and Accountability Project, SERAP, has sent an urgent appeal to the 3 UN Special Rapporteurs, urging them to use their mandates and request the Nigerian government and the leadership of the National Assembly to immediately reverse what they call the unlawful, disproportionate and discriminatory budget cuts to education and healthcare, and to stop the authorities from spending 27 billion naira to renovate the National Assembly complex. According to SERAP, in the revised 2020 budget approved on Tuesday, the federal government reportedly gave the National Assembly 27 billion naira for renovating its complex and cut health, universal basic education budgets by over 50%. It says that while the health budget is reduced from 44.4 billion naira to 25.5 billion naira, the universal basic education budget is reduced from 111.7 billion naira to just 51.1 billion naira. SERAP's Deputy Director, Mr. Kolawole Oluwadare, explains that Nigerian authorities are putting politicians' allowances and comfort before citizens' human rights, and that the budget cuts show the failure to address the growing economic and social inequality in the country. The National Human Rights Commission, NHRC, has issued an advisory to protect the rights of the Almajiri children during the COVID-19 and post-COVID-19 period in light of their return to the states of origin, their states of origin. Governors of the northern states had agreed to use the opportunity of the lockdown to return all Almajiri children to their state of origin. This decision, according to the Commission, violates the rights of the children, freezing the freedom of movement across state boundaries, among other freedoms. In the advisory, it stipulates that in dealing with Almajiri children, the best interests of the child principle enunciated under the Convention of the Rights of the Child and the Child's Right Act should be topmost considered. But how many states have domesticated the Child Rights Act, a law which seeks to protect a child's survival, development, education, be it under the protection and guidance of the parents, the guardian, or the state? This is also coming on the heels of the uproar on the rise in cases of sexual and gender-based violence, especially the girl child and women in Nigeria. Let's now trace the heightened number of violations in the country. And joining us is the Executive Secretary of the Human Rights Commission, National Human Rights Commission, that is, Mr. Tony Ojukwu. He joins us from our Abuja studios. Welcome to the program. First, give us your reaction to the uproar we're seeing over social media as to the rise in sexual-based violence, rape, abuse of minors, students who would have been in school if not for the COVID-19 pandemic. How is the Commission monitoring these horrors?
Thank you very much, Millicent, for having me here. I think I want to join the rest of Nigerians in condemning the alarming rate of sexual and gender-based violence, especially rape, that seems to be ravaging our country at this time. It's horrible, and everybody is worried that we cannot go on like this. We need to have a national plan of action, a national emergency on sexual and gender-based violence, especially rape. The matter in Benin, where the University of Benin student was raped, the Commission is working with stakeholders to make sure that the case goes on. One of the suspects has been arrested in Benin, and the governor himself has directed that action must be taken. Of course, you know that the Inspector General of Police has also directed that immediate action should be taken in that matter. In the case in Jigawa, of course, the Commission is also working with the police. 11 of the suspects who raped the young girl have been arrested. One person is still out there. And every step is also being taken to make sure that there's justice there. And of course, we've also heard of the sad case that came up in Ibadan yesterday or 2 days ago, where a girl was discovered in her parents' home in a pool of blood. We've in touch with the police PPRO in Ibadan, and right now they are not yet sure what actually happened, whether it was armed robbery or whether it was a rape case, but the police is on that, and we're insisting they need to unravel the circumstances surrounding the date. Of course, you also know of another case in Ekiti where a 17-year-old girl was also gang raped by some street urchins, about 3 of them. 2 of the culprits have already been arrested. They are going after the other one. I think as a people, we must make sure that anybody involved in this kind of heinous crime is held accountable. We must, as a people, agree that this is not the way to go. The COVID-19 has thrown up a lot of issues, and one of them has been this increase in sexual and gender-based violence, especially rape. We don't understand whether it is because the young people are idle at home, back from school, they are not engaged, there is restriction, freedom of movement for people to go about doing other things that is leading to this increase. We are still studying the situation, but you'll agree with me that the rate of sexual and gender-based violence during this period has really disturbed everybody. And
Briefly,
we must rise in unison to condemn this and take action to make sure that this is not the way to go for our country.
Briefly, Mr. Ojukwu, just because we have just a few minutes to wrap up on the program, and this is with regards to Almajiri. What's the position of the Commission with regards to the freedom of movement so far in the northern region?
Well, of course, the statement that the Almajiri children should go back to their state of origin, of course, violates the freedom of movement of those children. But looking at the freedom of movement in relation to the best interest of the child, children are supposed to grow up within the protection of their parents, their guardians, and the state government. They need to be given opportunity of survival, education, and development. And we think that if they grow up in their states, in the comfort and protection of their parents, it's good for them. So we think going forward that every state should draw up a program of action for the reintegration and rehabilitation of these Almajiri children. And the Commission is happy to work with all the states to make sure that human rights is mainstreamed into the reintegration and rehabilitation of these children, so that they're taken to school, so that those of them that need to be empowered are empowered, so that their families are also empowered to make sure that what predisposes them to becoming Almajiris is dealt with right from the roots. So all the northern states, we think, should also pass the Child Rights Act, because that is one act that is so much important to make sure that the best interest of the child is put forward in everything concerning the child.
We'd like to thank you, Mr. Tony Ojukwu, Executive Secretary of the NHRC. Thank you for joining us on the program.
Thank you, Millicent.
And 2 weeks after Israel fully reopened schools, COVID-19 outbreak sweeping through classrooms has led officials to close dozens of schools where students and staff were infected. It's a new policy ordering any school where a virus case emerges to shut down. And the NCDC continues to work closely with states. You can find the latest national strategy to scale up access to coronavirus disease testing in Nigeria, and also other public health advisory on the COVID-19. Also, the World Health Organization's website, Each Moment, there are regular updates about the spread of the pandemic. You can find the COVID-19 strategy on their website and the public health response. You can take a closer look at some of the numbers real-time. Channels Television, it's COVID-19 case monitoring portal on our website, www.channelstv.com. You can find the latest figures there, and many more stories all at your fingertips. Just log on to channelstv.com. And that's our COVID-19 special edition on Channels Television in collaboration with the Ford Foundation. Thank you for watching. Another COVID-19 update comes your way again at 9 p.m. Until then, I'm Millicent Walker. Stay home, stay safe.